Next, I want to introduce Dr. Tracy Greene. I've known Dr. Greene now for some number of years, and we have worked together on a few things over that period of time. I actually dragged her to Maine to talk to some of my U.S. Attorney colleagues and get us walking down a path that maybe we weren't prepared to walk down before. Dr. Greene, along with Dr. Rich, chaired the Governor's Overdose Prevention Task Force, wrote the plan that, with the legislature's support and the Governor's support, has really pivoted us in such a way as a state where we're making real progress. Dr. Greene is an associate professor of emergency medicine at BU, where she is deputy director of the Boston Medical Center Injury Prevention Center. She also holds an appointment as an associate professor of emergency medicine and epidemiology at the Warren Alpert School of Medicine at Brown University. Dr. Greene is an epidemiologist whose research focuses on drug abuse, addiction, and injury. Also, non-medical use of prescription drugs, corrections health, drug policy, and opioid overdose prevention and intervention. Dr. Greene.
Thank you very much. In 2017, 324 Rhode Islanders lost their lives to drug overdose, and there are an estimated 20,000 people with opioid use risk in the state, where only half are receiving treatment at any given time. As an epidemiologist at Rhode Island Hospital and Brown University, my work and research focusing on drug overdose have brought the chance to see firsthand and analyze at a population level the challenges of opioid use disorder and the promise of the proposed legislation being announced today. I can say with confidence that the science shows that we're making good strides in Rhode Island, better actually than many other states in the country, and there are finally some bright spots on the horizon. Single-digit but significant reductions in mortality since 2016, for one. Thanks to bold and evidence-based actions of Governor Raimondo and the support of the Rhode Island State Legislature, we have a groundbreaking model delivering and initiating treatment for opioid use disorder right in our backyard for people with opioid use disorder that does save lives. And there are many more bright spots. The BH Link, Centers for Excellence in Medication-Assisted Treatment, emergency departments and hospitals that are initiating medication treatment, pharmacy-based therapies, even fire stations in Providence can connect people to care. But we cannot take our foot off the gas. We have to look to the drivers of the epidemic and work to undermine its weakest points. Incarceration is a major public health crisis, and a major one. Conditions in places where people live, learn, and work and play affect a wide range of health risks and outcomes, and those conditions are known as social determinants of health. Incarceration is a major social determinant of health for people who use drugs and their family members and friends. It alters the risks that people take when they use drugs. Once in jail or prison, even for a few days, a person's tolerance to drugs are undermined and changed and result in astronomical risk of death within days post-release when they return to use. Many people who are receiving treatment for their addiction or mental health condition experience a large disruption in care when they're charged and convicted and spend some time behind the walls. They might lose access to medication or be forced to switch to an entirely different one. Their relationships that they've worked hard to garner with trusted health providers may be severed. With the highly potent and fast-acting drug fentanyl ever present in the illicit drug supply, changes in people's tolerance, disruptions in their care, and relapse to drug use have never been more lethal. People who use drugs are better off in the community, where their condition can be treated, their health needs met, and their future choices in employment and housing, for instance, not limited. Incarceration has a huge domino effect, too, for generations to come. More than half of the people behind bars are parents. Keeping families together and helping parents get the life-saving treatments for substance use disorder that are available here in Rhode Island is our priority, and this bill removes obstacles that too easily and unhelpfully get in the way. Mass incarceration is a public health scourge in the US, and the only real reasonable response here is to limit the unnecessary use of incarceration across the board. Creating environments that promote good health for all is made concrete and real by bold and evidence-based actions like those of the Office of Attorney General in Rhode Island. So this bill reduces disruptions and preserves health. It gives community resources more chances to reduce harm and to help our friends, family, and neighbors who use drugs. I applaud the Attorney General and the Senate Majority Leader for taking these bold efforts to take on a fundamental driver of addiction and disparities and reach for those lasting positive changes for generations to come when it becomes law. Thank you.